We're going to begin with Dr. Jeff Schlegelmilch up at Columbia, who's worked very closely with us over the years and has been a great asset. And he's going to be talking about specifically equity, climate change, and public health preparedness. And Jeff, the microphone is yours.
Wonderful. No, thank you so much for having me be a part of this. It's unfortunate we're not in person, but we got to do what we got to do, and it's good that we're making it work the way that we're making it work. So really thrilled to meet with folks. I've actually done a few in-person events, and there's something artificial about being in person when we have to mask up and distance too, that sometimes Zoom does feel more authentic. I don't know, maybe it's just a weirdness of how I'm interpreting things. Anyway, it's good to see you in whatever forum that I'm seeing you. Okay, I'm going to bring up some slides and I'm going to talk a little bit about equity. You know, equity, this is one of those things that, you know, to be totally honest, I don't always know the best way to talk about it. We know there's a lot of inequities in our society, and it's just, it's big, it's rooted in a lot of different causes. There's no single lens that fully explains all of it. And to be totally honest, I sometimes question, am I the right person, being a white male at an Ivy League institution who's been probably more on the beneficiary side of inequities. But I think at the end of the day, it's important that we talk about it, and we talk about it however we can, and we continue to explore and keep these dialogues going towards action and towards actually kind of deconstructing some of the root causes of equity. Because as we'll see, of course, we've seen these inequities in the pandemic, and we are seeing and will continue to see them widen with the impacts of climate change if conscious efforts aren't made to actually address them in the way that we respond. And I have a few very specific examples, but they're just illustrative of that. So a little bit of level setting. This is a graphic that a colleague did based at a center in Spain. It's tough to read, but basically the really, really small font are different citations of literature and different uses of the term resilience. And when we look at it, you know, what we're finding is that a lot of research is sort of done in very, very specific areas, right? When you look at resilience, what does that mean? Well, if you're an engineer, you're probably looking at the built environment. If you're a social scientist, you may be looking at the social or the social psychology or the anthropological aspects of that. There are political aspects, there are planning aspects. And what you end up with is these different resilience profiles. So if we look at resilience strictly from, the perspective of the built environment, we can grow resilience, but we can actually cut off communities and erode social resilience. So when we try to oversimplify these things, we sometimes lose that granularity, and we tend to overvalue certain types of interventions that may actually lead to greater inequity down the road. So it's the case that he makes is that Dr. Lorenzo Cellari is that, we really need these resilience profiles, and we need to look at these trade-offs between different kinds of resilience. Another piece, I like this definition on where, when we talk about risk, it's really this formula, the hazard times the vulnerability divided by the capacity to cope. This starts us to get us in the direction of a very well-established field of social determinants of health. We know that place has a lot to do with health, what you have access to, what sort of environment you're living within, and place also correlates strongly with socioeconomic status and with race and with language status and a variety of other measures. And so when we start thinking of disaster management and climate change from beyond purely the hazard and the vulnerability, we do start to get a better sense of sort of the spatial unevenness that is an important part of that risk. And of course, revisiting some of the social determinants of health. This is just a great graphic sort of looking at sort of this lens that we start with these social and environmental determinants that begin with how a society organizes itself. What are the power structures? What are the privilege structures? Who has access to different levels of government, social capital, social cohesion? These things can all be big determinants in terms of access to the things that actually accumulate more into biological determinants, where you see greater proportions of chronic diseases, and how then that can be exposed to, if we talk about something like climate change, increased heat, increased humidity, who is more susceptible, who has older housing stock that's less energy efficient, et cetera, et cetera. So ultimately leading to these very clinical outcomes, although with roots that are much more sociological in nature. Folks may be aware of this. I think this is one of the best tools we have available is the CDC's Social Vulnerability Index. And so it takes social vulnerability and looks at it across 4 different domains. And each of those domains has different measures that correlate with vulnerability. I like to say we don't know who is going to need help, but we know where is going to need help. And so this was encouraged, if folks recall, in the COVID-19 vaccination strategies and testing strategies to actually try and concentrate centers in areas of higher vulnerability. What we saw initially with a focus on speed is that they tended to go to places that you could reach the easiest. The problem is the places that you can reach the easiest are the ones that have the most access to the resources of civil society before a disaster, also have it afterwards. And so you saw folks with less access to transportation, hourly wages, couldn't get away from work, actually having to travel farther. So a higher burden and a lower capacity to get to testing sites. So actually at a much higher burden, it's a compounding burden. And we saw it similarly for a while with vaccinations, although some of that was sorted out through some very conscious efforts, although certainly not universally. And I do want to mention here that a very strong predictor is race, ethnicity, minority status, that these structures are very real and they translate into very real outcomes. And I'll give a few examples of some of the structural discriminatory policies that have led to that. Specific with COVID, the Sergo Foundation put together a similar social vulnerability index, which contains many of the same domains, sort of stacked a little different and is more specific, where the CDC's is all hazards. The Sergo Foundation's is very pandemic specific, and it correlates very strongly where you see people of higher vulnerability, more likely to be diagnosed with COVID, more likely to have died from it, and more likely to be unemployed as a result of it. And I can share my slides after as well, too, if folks want to sort of click on the links and pull from this. Just about all this is public facing. This is a blog post some folks from our team, they pulled together. So this is secondary data that we pulled from other places. So the City University of New York has been doing some tracking surveys this earlier on in the pandemic between weeks 2 and 6. And so you see here, disproportionate impacts among the Latinx community, among Black and African Americans, Asians, and et cetera, in terms of cases versus the population representation, but also job loss and the economic impacts, which we know also has cascading impacts on health effects. And then what you see on this other side is some mapping looking at things as positive cases, service workers, rent-burdened households, and people of color. This is a really important story. And I want to note this because, there were some policy discussions early on about cloth masks and how protective they may be and whether to recommend it. And there was a lot of, from what I understand, a lot of discussion and ultimate decision to not recommend cloth masks because primarily because the messaging was for people to stay at home, and that if you gave them sort of an inferior mask to go out, even if it had some protection, that the behavior change would outweigh the benefits of the additional protection. This map is really important because these are the folks who could not stay home. They had to take the subway. They were essential workers. They were hourly workers, lived in more dense households, communities of color, communities of lower socioeconomic status, that did not have the choice. And so we have to think about these things. I don't think that that decision was overtly racist, but it did have implications in terms of disadvantaging people, of exposing people without all the information they could possibly have to protect themselves, who had to take the subway, who had to go into work, who didn't have the luxury of staying home. And again, I'm not trying to be critical of individual decision makers, but of the decision-making process of not necessarily including that to the level that I would argue should have been. Vaccination progress. So we've seen a lot too, just in terms of communities' access. So, we heard some great things earlier talking about the media and talking about trust. And again, certain populations who have not historically had a good relationship with government, who have been taken advantage of by government. The Tuskegee experiments is one of the more well-known issues leading to a lot of vaccine mistrust, but there's a lot of just broader inequities in the way that service is experienced and the way that service is available. In New York, the Rockaways as a community, a lot of times is not gotten the attention of the administration and not gotten the attention of the city and missed out on a lot. And then all of a sudden the government comes in and says, hey, get this shot, be a team player. It's a very different thing if you've been left behind and not enjoyed the benefits that other parts of the city or the country or the community has experienced. And it shows up in the data. There's not a lot. There are things you can do in terms of getting into communities and targeting services and working through local organizations. But the table is set for a lot of these things through policies that are put in place long before disasters strike. So when we talk specifically about climate change, again, what we're looking at these inequities is a very strong spatial context, a very strong history of what was invested where. So on the left, we're looking at cities redlining policies. So redlining 100 years ago, looking at redlining policies and essentially leading to divestment and lack of investments, lack of home ownership, lack of wealth accumulation in majority minority communities as a result of that. And there's a lot of studies looking at long-term health impacts, economic impacts, all of the cascading effects from that. This is a study looking from Redfin, the real estate firm, finding in most cities there's a higher risk of being in a floodplain in a formerly redlined area. So again, there's this dual burden of lack of investment in infrastructure and higher exposure to the risks, to the hazards that are being faced. And then this other one, this was actually a New York Times article, but there have been more peer-reviewed studies looking at, this one just had pictures, that we're expecting to see higher temperatures, the urban heat island effect as a result of climate change. In this case, the pavement was 31 degrees hotter. If you look on the left and the Upper West Side, you see a lot more foliage, a lot more tree cover, and in Harlem, a lot less, a lot more of that sun hitting. I believe the numbers were somewhere between 6 and 12 degrees Celsius are the potential increase in formerly redlined areas. So again, older housing stock, less energy efficiency, a lot of times higher energy burden, and on top of that, more exposure to extreme heat. When we look at issues with the grid and the power grid, and I've been doing a lot of work with a variety of different groups on that. So this is from the Texas blackout. And so there was an analysis here looking at the power outage. And if you were in a community of color, you were more likely to experience an outage and to experience it for a longer duration. And that's after controlling for things like proximity to critical infrastructure and things like that. And so in addition to that prolonged outage and exposure to the extreme cold afterwards and the damage to the pipes and things like that as a result of the freeze, you saw an exacerbation of the economic impacts and the health impacts that were already going on from COVID-19. This other point I'd make, it's probably one that's been brought up before, is that, as we know in disasters, indirect deaths largely outnumber direct deaths. And that too has a lot to do with pre-existing chronic disease conditions. I believe in one analysis I saw from hurricanes, cardiac arrest was the #1 cause from the analysis. It's a very imperfect system of measuring. We have good case studies for direct deaths. Indirect deaths are a lot harder, and they range from surveys to comparison of expected mortality and comparisons over time. So you see a lot more ranges, but these are the orders of magnitude that we tend to see. And again, similar among communities' capacity to cope. So the need for sustained primary care, secondary care, to help prevent that more severe emergency care is going to be needed, particularly in areas more vulnerable than others. And the other piece that I would say here too, so these are some fancy looking graphs that I sort of use to fill the page while I talk to you about something, is that it's from a couple of articles. California's been doing a lot of work looking at the grid. And so when we look at the grid and we look at who has access to these innovations, these things that are going to dig us out, that are going to give us cheaper energy, and you find that communities that are majority minority and communities of lower socioeconomic status don't have regular access to EV charging stations. And on the right comes from analysis that the grid in a lot of these neighborhoods is not at a level where it can actually host a lot of the solar panels. So in wealthier areas, if you can have solar panels, then you can sell some of that energy back to the grid. And in a lot of lower income areas, you can't, the grid just isn't capable of doing that. It's in need of significant upgrades. So again, this infrastructure policy, economic development policy are all setting the stage for adverse health outcomes and climate change is pressuring that on all sides, and we expect to see that to continue. So I think just some basic guidelines. There's some resources I recommend. The Institute for Diversity and Inclusion in Emergency Management, NAACP has some good resources. FEMA is putting more out there. But really what it comes down to is investing in communities, building partnerships. I think in particular, working with the institutions that are already in communities. There's a lot of evidence that this sort of restorative justice, that reinforcing the institutions and communities rather than supplanting them, and increasing representation, really targeting programs, have been a really effective means at doing this, but it has to be done in a genuine way, not imposing external solutions under the auspices of community engagement. So with that, I think I'm only a half a minute over, which is pretty impressive for in my book. I'll pause, and I'm happy to take any questions and to hang on. So thank you again.
Thank you, Jeff. That was quite informative and stimulating. We're going to do questions after the next presenter.